recognized.
Mr. President, I rise today to pass into law life-saving bipartisan legislation that will enable us to keep fighting the opioid and fentanyl epidemic, an epidemic that has destroyed families and devastated communities all across our country. Our country faces many challenges, and I'm sure we'll continue to debate in the coming weeks how to address those. But today, we will advance on a bipartisan basis life-saving legislation that we know is working to combat fentanyl. New data from earlier this summer found that drug overdose deaths dropped 27% last year compared to the prior year. Since the advent of the opioid crisis, we now have a much better sense of what works to prevent and treat addiction, the resources we need to do so, and the light that exists on the other end of this terrible tunnel. But we can only get there if we keep up the fight. The SUPPORT Act of 2018, signed into law by President Trump during his first term, established vital addiction treatment infrastructure. Reauthorizing this bipartisan law is essential to our addiction prevention, treatment, and recovery efforts. For example, the act includes funding for addiction treatment for pregnant women and funds for training and equipment to help first responders in this fight. The original SUPPORT Act passed the Senate with 98 votes, and this bipartisan reauthorization passed the House with 366 votes. Now the Senate will send it to the President's desk. While we have made progress in this fight, we cannot be complacent. And while there are still too many families and communities ravaged by addiction, we cannot despair. Nothing less than people's lives depend on us acting. So, Mr. President, as if in legislative session and notwithstanding Rule 22, I ask unanimous consent that the Committee on Health, Education, Labor, and Pensions be discharged from further consideration of H.R. 2483 and the Senate proceed to its immediate consideration.
H.R. 2483, an act to reauthorize certain programs that provide for opioid use, disorder prevention, treatment, and recovery, and for other purposes.
Without objection, the committee is discharged and the Senate will proceed to the measure.
I ask unanimous consent that the bill be considered read a third time and passed, and that the motion to reconsider be considered made and laid upon the table.
Without objection.
Mr. President, the Senate has just passed a major bipartisan package to reauthorize the SUPPORT Act, and it is now headed to President Trump's desk. Today is proof that despite our differences, bipartisan progress is possible. I'm particularly pleased to be here with my colleague and chair of the Health Committee, Senator Cassidy, who has been instrumental in this fight and who will speak in just a moment. To our first responders, know that training and equipment is coming to help make your job easier. To our healthcare providers, know that resources are coming as you help people get and stay in recovery. And to those battling addiction, know that support is on the way. I am deeply grateful to a number of my colleagues on both sides of the aisle, and I'm looking forward to Senator Cassidy's comments just now. I'm also grateful to Senator Sanders for working with me on getting this done, as well as the advocates who knew we could not give up in this fight. This package, Mr. President, will save lives, and I look forward to continuing to make available every tool that we have to stop fentanyl. Thank you, and I yield the floor.
Mr. President.
Senator from Louisiana is recognized.
Mr. President, I start by thanking Senator Hassan so much and Representative Brett Guthrie and other colleagues for their work to pass the SUPPORT Act. It's part of as a doctor, I would say a pro-patient, we'd all say a pro-family agenda that we wish to deliver for the American people. About a month and a half ago, President Trump had a signing ceremony for the Halt Fentanyl Act at the Capitol, at the White House. And that was my bill, so I was privileged to be there. And behind him were families holding the pictures of their children who had died from fentanyl overdose. Incredibly moving. I had a similar ceremony in Baton Rouge where across Louisiana people came and held a picture of their child who had died. And in one case, the young man had a hard time sleeping, and somebody at his church gave him a pill to take, and he took the pill. It was laced with fentanyl, and he died of an overdose. Now, this is an incredibly powerful addictant, an incredibly powerful ability to kill drug. The Halt Fentanyl Act is one part of it. It gives support to law enforcement as they attempt to combat the scourge. The Support Act is supporting those who are delivering that primary care, that first responder care, that care of a family to a loved one who might be addicted, a care to the patient herself or himself. Just this morning, I was on a radio program with Ted Dumas out of Louisiana, and we were talking as we asked about the Halt Fentanyl Act. There is somebody listening to this program who is addicted to fentanyl and is looking for a way out. There's some family member listening who knows they have a family member with a fentanyl addiction or some other addiction who needs a way out. The Support Act is giving them the tools they need to either come out of addiction or to help someone come out of addiction. And let me just give a shout out to President Trump. Since he's taken office, we have seen a control of the southern border. We have seen the Mexican army going after cartels who have been manufacturing and bringing in the fentanyl. And we've seen the chemical companies in China, which Senator Hassan and I, when we went to China last year, specifically asked the leadership of China to control. President Trump is going after those chemical companies and after the government of China in order to control those chemical companies. This is a full court press our government's making, giving credit to President Trump where credit is due, but also to the Congress for passing both the Halt Fentanyl Act and now the Support Act. We are working to control this scourge. I look forward to this being signed into law. I look forward to continuing to work with congressional colleagues and the President to enact a pro-family, pro-patient agenda that addresses this. I look forward to people coming out of addiction. One death from overdose is one death too many. With that, I yield.